Stroke can happen to anyone, at any time. It doesn't discriminate based on age, gender, or lifestyle. Whether you're young or old, healthy or dealing with other medical conditions, the risk is always present. It's a medical emergency that occurs when blood flow to the brain is interrupted, depriving brain cells of vital oxygen and nutrients. This interruption can be caused by a blocked artery, known as an ischemic stroke, or the bursting of a blood vessel, known as a hemorrhagic stroke. Both types are equally dangerous and require immediate medical attention. This can lead to brain damage and potentially long-term disability, or even death. The extent of the damage depends on how quickly the stroke is treated. The longer the brain is deprived of blood flow, the more severe the damage can be. This is why time is of the essence when dealing with a stroke. However, many strokes can be prevented or their impact minimized if we understand the early warning signs and take swift action. Recognizing symptoms such as sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking, or difficulty understanding speech can be crucial. This essay will delve into the often subtle signs of stroke, empowering you with the knowledge to protect yourself and your loved ones. By being aware of these signs, you can act quickly and potentially save a life. It's not just about recognizing the obvious symptoms, but also understanding the more subtle indicators that something is wrong. We'll explore the science behind these symptoms, examining the physiological, biochemical, and medical reasons why they occur. Understanding the underlying causes can help demystify the condition and make it easier to identify when someone is having a stroke. This knowledge is not just for medical professionals, but for everyone. Armed with this understanding, you'll be better equipped to recognize the warning signs and seek immediate medical attention, potentially making a life-saving difference. Remember, every second counts when it comes to stroke. The faster you act, the better the chances of recovery. So stay informed, stay vigilant, and be prepared to act swiftly if you or someone you know shows signs of a stroke. Please subscribe now to join our community. Give a thumbs up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, MedSign Health 360, has many more videos to bring the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback, so share your thoughts and let us know what you think. Pause 2S. Recognizing the early warning signs of a stroke can make all the difference. It's crucial to be aware of the subtle indicators that something might be wrong. Sometimes these signs are easily overlooked or mistaken for other less serious conditions. But knowing what to look for can save lives. One of the most effective ways to identify a stroke is by using the acronym FAST. Pause 1S. Face drooping. Is one side of the face numb or drooping? Ask the person to smile. Does the smile appear uneven? Pause 1S. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Pause 1S. Speech difficulty. Is speech slurred or strange? Ask the person to repeat a simple sentence. Is the sentence repeated correctly? Pause 1S. Time to call emergency services. If any of these signs are present, even if they go away, call emergency services immediately. Time is of the essence. Pause 2S. These simple steps can help you quickly assess whether someone is having a stroke and ensure they receive the urgent medical care they need. Remember, every second counts. The faster you act, the better the chances of minimizing brain damage and improving recovery outcomes. Stay alert, stay informed, and be prepared to act swiftly. Pause 2S. Please, subscribe now to join our community. Give a thumbs up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, MedSign Health 360, has many more videos to bring the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback, so share your thoughts and let us know what you think.
At the heart of a stroke lies a process called ischemia, a dangerous reduction in blood flow to a part of the body, in this case, the brain. This reduction can be caused by a blockage in the arteries, such as a blood clot, or by a narrowing of the blood vessels due to conditions like atherosclerosis. When ischemia occurs, the brain is deprived of the vital nutrients it needs to survive and function properly. When blood flow is restricted or completely blocked, brain cells are starved of the oxygen and glucose they need to function. Oxygen and glucose are essential for the production of energy within brain cells. Without these, the cells cannot perform their normal activities, leading to a cascade of cellular dysfunction. This lack of energy disrupts the delicate balance of ions within the cells, causing them to swell and eventually die. Without these essential nutrients, brain cells begin to die rapidly. The death of brain cells or neurons can occur within minutes of the onset of ischemia. This rapid cell death is what makes strokes so devastating. The brain is an incredibly complex organ, and the loss of even a small number of neurons can have significant effects on a person's abilities and quality of life. The longer this deprivation continues, the more extensive the brain damage becomes, potentially leading to permanent neurological deficits. Prolonged ischemia can result in large areas of the brain being affected, leading to severe impairments in movement, speech, memory, and other critical functions. In some cases, the damage can be so extensive that it results in a complete loss of independence, requiring long-term care and rehabilitation. Understanding the concept of ischemia is crucial for grasping the urgency of recognizing stroke symptoms and seeking immediate medical attention. Early intervention can make a significant difference in the outcome of a stroke. Treatments such as clot-busting drugs or surgical procedures to remove blockages can restore blood flow to the brain and minimize damage. Recognizing the signs of a stroke, such as sudden weakness, confusion, or difficulty speaking, and acting quickly, can save lives and improve recovery outcomes. The brain is a complex organ with intricate biochemical pathways that are severely disrupted during a stroke. When blood flow is compromised, a cascade of harmful and damaging events occurs at the cellular level. Neurons, the specialized cells responsible for transmitting information throughout the brain, are particularly vulnerable to ischemia. Deprived of oxygen and glucose, they lose their ability to maintain their electrical potential and communicate effectively. This disruption in neural communication contributes to the neurological deficits observed during a stroke.
While stroke can affect anyone, certain medical conditions significantly increase an individual's susceptibility. Understanding these conditions can help in taking preventive measures and managing risks effectively. High blood pressure or hypertension is a leading risk factor for stroke. It is often called the silent killer because it can go unnoticed for years while causing significant damage to the cardiovascular system. Over time, uncontrolled high blood pressure damages the lining of blood vessels, making them more prone to narrowing and blockage. This increases the risk of both ischemic strokes, which occur when blood flow to the brain is blocked, and hemorrhagic strokes, which happen when a blood vessel in the brain bursts. Atrial fibrillation, a type of irregular heartbeat, also raises the risk of stroke by promoting the formation of blood clots in the heart. These clots can then travel to the brain and cause a blockage, leading to a stroke. Managing atrial fibrillation through medication and lifestyle changes is crucial in reducing stroke risk. Diabetes is another significant risk factor. High blood sugar levels can damage blood vessels over time, making them more susceptible to blockages. People with diabetes are also more likely to have other conditions that increase stroke risk, such as high blood pressure and high cholesterol. High cholesterol levels contribute to the buildup of plaques in the arteries, a condition known as atherosclerosis. These plaques can narrow or block arteries, reducing blood flow to the brain and increasing the risk of stroke. Obesity is another condition that can elevate stroke risk. Excess body weight can lead to high blood pressure, diabetes, and high cholesterol, all of which are risk factors for stroke. Maintaining a healthy weight through diet and exercise is essential for stroke prevention. Smoking is a major risk factor as well. It damages blood vessels, raises blood pressure, and reduces oxygen in the blood, all of which can contribute to stroke. Quitting smoking is one of the most effective ways to reduce stroke risk. Regular checkups with your healthcare provider can help manage these conditions and reduce your stroke risk. Early detection and treatment of these underlying conditions are key to preventing strokes and maintaining overall health.